Children today see themselves so many times in social media that perhaps they're precocious and they really care about how they look. They notice if they have a bad nose or sometimes even if they have a weak chin, and they ask their parents a lot of questions. I think it's your job probably as a parent to help enable your child and get them to a good, appropriate doctor to have an evaluation that involves computer imaging and looking at before and after results. I want to show you today some results that I've had with patients. Sometimes these patients weren't sure whether they should do the surgery. They probably had some insecurities like most parents or most children do, but a consultation is a great way to get over that, and perhaps looking at some of these images will help you as well. So in this case, this is a young lady in the age 15, 16 years old who was a good athlete, was concerned about how her nose looked. We removed a large hump. We raised the columella, which is the bottom part of her nose between the two nostrils, and we sharpened the tip. And she really looks now like she has a normal nose that fits her face and looks very natural and doesn't draw a lot of attention. And it allows her other features, her nice eyebrows, forehead, eyelids, lips, appropriate chin and neck, all to kind of come out. So it made her feel better about herself. So in this second case, this is a young lady who has a very crooked tip of her nose. Some of that is from the septum, some of it is a wide tip alone. So it probably wasn't that hard for the parents to figure out maybe something should be done, and their pretty daughter had a crooked nose. But by bringing her in, you can see the result that we got, a straightened nose that's much more refined. And you can almost see the brightness in the young lady's eyes that she feels better about herself. I think her self-esteem, you can almost just see from this picture, looks like it grew quite a bit. We're going to go now to the next picture, which is a side view, which also should give you a good feeling about when the tip projects, they feel stronger and they feel better about themselves. And when the tip isn't flat and down and wide, they feel a lot more feminine and have a lot more angles they can use in their face or with the makeup, or in this case with their hair, to make themselves look good. In this case, this young lady had a fairly typical curved tip. The nose projected quite a bit. It just didn't seem to match her cheeks and her jawline. So by getting rid of the bump on her nose, sharpening her tip, raising the bar underneath, which is called the columella, a little bit, it just looks like it matches her face, and her nose sort of just effortlessly fits on her face and looks very natural instead of something that draws attention. Personally, I love doing teen rhinoplasties. Rhinoplasties in general are fun, but with teenagers you can be changing their lives and how they feel about themselves. So I've got so many kids who have come in thinking about themselves one way, and you can see months later they think about themselves in a much more positive light. It's exciting.